works at the Oakville Trafalgar Memorial Hospital in Ontario. Franky graduated from the Leslie Dan Faculty of Pharmacy at the University of Toronto with his Bachelor's of Science in Pharmacy in 2013 and a Master's of Science in Nanopharmaceutics in 2019. He has co-authored a number of publications, namely in Nanomedicine and Herbal monograph in the now offline Camline for Ginkgo biloba. I hope I pronounced that. Currently, his practice involves providing direct specialty patient care to patients with kidney disease and heart failure. So it is my pleasure to introduce you now to Franky Liu. Hi, Franky. Welcome.
Hi, nice to meet you all. Thank you so much for the kind introduction. I'm here because I wanted to kind of start a conversation about a very important topic to pretty much everyone in the audience, including myself, and that's a discussion of non-prescription medications and supplements, whether it's herbal or vitamins or minerals, because these can affect the body in different ways for patients that have reduced kidney function. I wouldn't be able to go through every single medication that is non-prescription because that could easily become a 2 to 3 year lecture series. But this is just a very brief overview, a very general talk, so that we can hopefully give you some guidance on how to deal with non-prescription medications and how to assess. I'm sorry. There we go. Okay, I see. So this is, again, to provide a bit of guidance and also to prompt some discussions on how do we deal with things that are non-prescription, so things that are used for self-care. I'm a huge advocate for self-care. I think probably up to at least 90% of your decisions are based on you making your own decisions about your health. And this is a portion of it, a small portion of it on how to select the right things that are for your body. To begin this talk, though, I thought I'd just throw this out here just for transparency reasons. So I'm just going to declare some conflicts of interest or potential conflicts of interest. So meaning that I'm just talking about any potential monetary gains from certain from other companies or whatnot. So I will disclose that I have received a very small payment from Novartis, which is a drug company, for moderating an unrelated talk in 2022. So I received a little bit of funding for talking about a heart failure medication, but it's not related to kidney disease. It's not related to herbal medicine. I will also disclose, as kind of mentioned in the introduction, that I am also a research pharmacist for Halton Healthcare at the Oakville Trafalgar Memorial Hospital here in Ontario for various clinical trials. So I'm involved with coordinating and dispensing of investigational products for research by multiple different drug companies, but I don't actually get paid by any drug company in particular. I otherwise don't have anything else to declare. I don't hold any shares in any drug companies. I don't own anything that would be a conflict of interest. I will also make a disclaimer that I'm presenting this talk as an individual, as an independent professional. So Halton Healthcare doesn't necessarily endorse this talk, and I'm not speaking on their behalf, or I was not necessarily sent by the hospital to do this talk. I'm doing this as an individual. There's a lot of things to talk about, and if you do have burning questions about specific things that I mentioned for clarification, by all means do ask. What we're going to talk about today, again, is not to talk about every single product that's out in the market, but to kind of empower you to become an informed consumer so that you know what to look out for to determine if something is safe for you. I'm going to start with just making sure everyone's on the same page so that we all understand what a non-prescription medication is. So we'll talk a little bit more about that first. Then we'll talk about some general principles and general things that you should be cautious of when you are trying to purchase a non-prescription medicine. We will determine some things that you can look out for to determine if the product is safe and to determine if a product is licensed for sale in Canada. So whether or not you've picked the correct product from the shelf. We're also going to talk about something that I'm sure everyone has heard at some point, and that's what do we do or what do we know about products that are marketed to cure kidney disease? And these are usually herbal products in nature. We'll talk a little bit more about cannabis, so another name for marijuana, and how does that fit in patients with reduced kidney function. We'll also talk about finding information online. So I know that the internet is rich with lots of really good information, but it's also unfortunately rich with a lot of bad information too. So I'm going to talk about some of my favorite sources that I usually recommend to patients that I deal with in the kidney clinic that might find this important or find this valuable in their search for products for self-care. Let's start with the basics. What are non-prescription medications? You might have heard of this known as over-the-counter medication. So over-the-counter is the medical word for a non-prescription medicine. These are products that do not require a doctor or a nurse practitioner prescription to purchase. So these are things that you can grab off the shelf yourself. These things don't necessarily require intervention from a pharmacist, a doctor, or a nurse practitioner. The reason why they're sold these include medications or natural health products. So this can include things like herbals, vitamins, minerals, or homeopathic preparations. And these are considered generally safe for most of the public, as long as they follow the instructions that are written on the pamphlet, the label, or the box. So if you're taking more than it recommends on the box, then technically it is not a non-prescription medicine. So the idea is that you are to follow exactly what is written on the box in order for it to be generally safe for most of the public. However, there are some exceptions to the generally safe rule. So for instance, if a patient were to have reduced kidney function or reduced liver function or certain types of heart disease or diabetes, they don't necessarily fall under the generally safe category because there may be different nuances or different things we have to look out for patients, particularly those with reduced kidney function. How would we ever know if a non-prescription medicine is safe? Unfortunately, there is no real hard and fast rule. A lot of times, just for legal reasons, drug companies and natural health product companies may put a disclaimer on the label saying to ask your pharmacist or doctor if you have kidney disease. And there's usually a very good reason why. A lot of times these medications can cause harm, or they need to be adjusted. So if you're ever in doubt if a medication is safe for you, I would suggest to certainly reach out to a pharmacist, whether it's the pharmacist in the drugstore or in the grocery store, wherever you pick up your prescriptions, or to speak to your clinic team pharmacist that can certainly help you. I do this all the time on a regular basis, on a daily basis. I get a lot of these questions, and it's fine. That's why we're there. We're there to help navigate a very confusing world of non-prescription medicines. And of course, if you don't have access to a pharmacist, you can also ask your doctor or a nurse practitioner to see if they can provide a bit more information to you. Sometimes you might hear from a pharmacist or a doctor or a nurse practitioner that there is no information. We don't know if a medication is safe or if it affects the kidneys in any way. So in truth, if there is no information, it's best to assume that the product will affect the kidneys in some way. It might be that the medication needs to be reduced based on your percent kidney function. So the amount of dose, sorry, pardon me. Okay, sorry, I have an automatic light. So some patients may require, so where was I? Yes. So some medications may require that the dose be reduced. And that's because a lot of medications that are on the market, whether it's non-prescription, prescription, or herbal in nature, they can accumulate or build up in the body if your kidney function is not up to par. So the dose will be different based on your kidney function. So some with a kidney function of 30% or 60% or 50% may have very different doses. So it's important to reach out to someone who's able to guide you on that. And some medications are plain dangerous. There are some medicines that can cause direct damage to the kidneys and make it worse. We'll go over some examples of medications that can do that. So the first category of medications that could potentially cause harm to the kidneys, and so these categories of medicines that we suggest you avoid, first include the anti-inflammatories. You may have heard of these as NSAIDs. So NSAIDs is the medical word or medical lingo for anti-inflammatories. These can include non-prescription medications such as Advil or Motrin, or other generics or off-brands that contain a medication called ibuprofen. Another example is Aleve or the associated generics, which include naproxen, which is the name of the actual drug itself. The reason why we suggest patients to avoid these medications if they have a reduced kidney function is because it causes two things. It can increase the blood pressure, And it can also stress the kidneys and the heart out. It makes the kidneys and the heart work harder. And that can actually reduce your kidney function and can potentially affect your heart as well. So here are some examples of products that we would suggest to avoid if you have a reduced kidney function. So like you see here, the Advil and the Aleve. Another category of medicines are sinus medicines. You may have also heard of these known as oral decongestants. So again, that's the medical lingo. These include products such as Sudafed or its associated generics or off-brands, which contain a medicine called pseudoephedrine. Most cough and cold products, whether they're cough syrups or cough and cold syrups, cough and cold tablets or capsules, the day and night formulations, et cetera, and some allergy medicines will have sinus medicines hidden in the product. And it can be very tricky because there could be two products that look exactly the same, but one would contain the sinus medicine and one would not. Again, we suggest to avoid this for the same reasons, in that it can increase the blood pressure and put more stress on the kidneys and heart by making it work harder. So again, the two categories of medicines is that we suggest to avoid anti-inflammatories and sinus medicines. And here are some examples down here in the pictures. One thing I will point out, and a lot of times you might have heard a pharmacist from the kidney clinic to suggest to take acetaminophen or Tylenol if required for pain, because that is considered kidney safe. One warning I will give though is that Tylenol does actually they do produce cough and cold products as well. So when we suggest Tylenol, whether it's right for you or not, if we ever say to take Tylenol, what we mean is just plain regular strength or extra strength Tylenol or acetaminophen, which is the associated generic. Tylenol also produces a cough and cold. They produce sinus. They produce Tylenol Complete. Those products contain sinus medicines, and we would suggest not to take Tylenol Cold, Tylenol Sinus, Tylenol Complete, because those ones can also affect your kidney function. I thought I would also use an example to kind of illustrate how it can be very tricky to find these products and tricky to see that there are actual different products that look exactly the same. So I understand that now we're kind of in allergy season. So I would believe that some people in the audience would want to pick up an allergy medicine. So here's an example of one allergy medicine. So this is Reactin, which contains cetirizine, which is the allergy medicine. If you were to look just even on the same shelf, but just maybe adjacent to it, you might see a product that looks like this. So this is Reactin Complete. The main thing is that this product contains a sinus medicine. This sinus medicine is the oral decongestant, or the medicine that we suggest to avoid for patients with reduced kidney function. So if I were to make a suggestion, it would be to avoid the Reactin Complete and to pick up the regular strength Reactin as an example in this case. Another example of a product that does exist in the market that does have an allergy and an allergy sinus counterpart is Allegra, which contains fexofenadine. So this is also an allergy medicine that is technically kidney safe, but usually right beside it, there is a product called Allegra D. So the only difference between the two is that there's a letter D beside the name of the product. This is very tricky because it does also contain a decongestant or a sinus medicine. So you can see how, yes, you would avoid this product, but you can see how it's very easy to pick the wrong product if you weren't paying attention. If you were just to snatch something off the shelf to purchase because you have really bad allergies that day. So be very careful and slow down and make sure you read the labels carefully. It's also what might be helpful is actually to ask the pharmacy team at the drugstore to determine if a product contains a decongestant or a sinus medicine, and of course to explain your situation to them. Another kind of disclaimer or warning that I should mention is that the dose, again, similar to what I've mentioned previously, the dose depends on your percent kidney function. So the right dose will depend on whether you have 20% or 30% or 60%. So it's important to double check with someone who has the resources to find what the appropriate dose is for you. And again, the pharmacist at the drugstore or the pharmacist at the kidney care clinic can certainly help you with that. It's also handy, so it's a good idea to know what your last percent kidney function is, so that you can mention it to the pharmacist at the at the drugstore if required, so that they can select the product that's right for you. One more category of products that we suggest to avoid are general multivitamins. So this includes products such as One A Day or Centrum. It can be any of these products, so One A Day, 50 plus, men's, women's, et cetera, et cetera. This also includes off-brands or generics from different brands from popular retailers, such as the Kirkland brand for Costco, or the Life brand from Shoppers Drug Mart or Rexall or what have you. And the reason why is because they usually contain certain vitamins that can build up in the blood or potentially harm the kidneys. So for instance, the most common one that we kind of hone in on, so the ones that we pay attention to the most on, are things like vitamin C. So there is such thing as too much vitamin C in patients with reduced kidney function, because it can accumulate, or rather it can build up in the blood, and that can lead to a kidney stone. Okay, so that can cause further damage. Or vitamin A, which can build up in the body and cause, it can change your calcium levels in other parts of your blood work. So we wouldn't want that to happen. Okay, so we would generally suggest to avoid general multivitamins. There are specific complex products that are formulated for patients with reduced kidney function, but those are tailored to based on your situation. So that's best suited to ask your team, which may include a dietitian and or the pharmacist of the team. What are some other things to be cautious of for different products that exist on the market that are non-prescription or self-selected? The most important thing, and this is my advice to you, is always slow down. When you're about to purchase something, slow down and make sure you're picking up the right product and making sure that you ask the right questions. So most products, like I mentioned, will contain a disclaimer to speak to your doctor or pharmacist if you have kidney disease. This is a very valid disclaimer. It's something that you should take seriously and something you should certainly follow the advice for. So do ask someone if this is appropriate for you if you have kidney disease. I will also mention that most natural products, particularly herbal products, have not actually been studied in patients with reduced kidney function. So that may complicate things. It may make recommendations very difficult, and it may not respond the way that you thought it would, because we just don't have enough studies, whether the studies are too small or there's just not enough funding to do these research studies. There are also some potentially there may be some products on the shelf that do not have a license for sale. And that seems a little bit strange, but sometimes Health Canada regulates and authorizes and licenses products for sale in Canada. However, sometimes there's a lag period, so they're not perfect. Sometimes it may take a few months to even up to a few years before Health Canada finds out that there is a product that is not licensed for sale, in which case they would force them to withdraw the product from the shelf. But again, there have been case studies where there were products that have been sold on the shelf that do not have a license for sale, and they've been there for several years before Health Canada managed to seize the product. So I will show you a tip on how to identify if a product has been licensed for sale in Canada. And of course, the good old advice is that if it sounds too good to be true, it probably is. So there are a lot of products that claim to cure things or alleviate or to eradicate certain types of diseases that we don't necessarily have cures for. I would be very, very cautious about those claims. They're very, very bold claims that they may not be warranted. There may be some nuances behind them, or there may be there is obviously a drive to sell a product. So there are instances where there is again there's a drive to market something to a vulnerable population, and that's something you should be certainly careful about. So how would we know if a product is licensed for sale in Canada or is authorized for sale in Canada at minimum? So a product at least should contain a DIN or an NPN number. So what does that mean? A DIN number is a drug identification number. An NPN number is a natural product number. You can find this on the label of the product. So I have an example here of a product called Replovite. there is a NPN number that's written on the top right-hand corner of the front face of the label. So it doesn't always have to be in the same spot. It can be in, it's most commonly in this location, but it can also be on the top left. It can be on the bottom of the label. It doesn't matter as long as it's on the label somewhere, and it should start with either NPN or DIN. These numbers are licensure numbers. So these are numbers that tell you that the product is licensed for sale in Canada. However, these numbers don't automatically mean the product is safe for everyone. All it's saying is that there is a standard and a standard of quality to sell the product in Canada. So that means that the company holds some accountability to the product, so that if anything goes wrong with the product, they're the ones who have to respond to it. They're the ones who have that they have to respond to products that are being seized off the market, or if there needs to be changes to a product that may be contaminated. So there is a license, but it does not necessarily mean it's safe for everyone, especially if a patient has certain conditions such as those with reduced kidney function. Okay, as just a quick show of hands, how many of you have actually heard of a product that can cure kidney disease, whether it's online or whether it's from your friends or your family or maybe your hairdresser, or mechanic, what have you? How many of you have actually heard of a product that supposedly cures your kidney disease? Yeah, I think I got a few. I got a few nods there, but yeah, there are products that are marketed for curing kidney disease or completely recovering kidney function. I hate to be the bearer of bad news, but as of current, and I did an actual search, there are no proven cures for chronic kidney disease on the market as of current. So the goal of therapy in the kidney clinic for patients that have a reduced kidney function is to preserve the kidney function as much as we can. So the goal is we're trying to keep it from further damage. That's the best that we have so far. So all the medicines that we suggest in the kidney care clinic are meant to slow the damage or prevent it as much as we possibly can. It's not meant to necessarily cure kidney disease. So if you ever see products that are marketed for kidney disease, be very careful of the following buzzwords. So products that are marketed as a cleanse or a flush or a kidney tonic, these products, so it's based on an old system of medicine. So these products, based on our new understanding and our more modern research techniques, we have found that these supplements and herbs can actually harm the kidneys. And the reason why is because they actually make the kidneys work harder by forcing it to produce more urine. Another name for these kind of products are water pills or diuretics. So those are some other terms that we use. And this is based on old thinking from old systems of herbal medicine, where it was believed that if a person were to get a lot of urine infections, that means that their kidneys were failing. So that was kind of the old mentality. So the idea was that if you're able to flush your bladder, so if you flush with lots of urine, then your chances of getting a urine infection is much more reduced. So in that explanation, it does make sense in old systems of medicine, but in more modern types of medicine or medicine systems that we do lots of research on nowadays, we find that that's not the case. Kidney disease is much more complicated than that. It's there's a lot of different structural things, a lot of chemical things that occur in the kidneys that extend beyond just urine infections. So just keep that in mind. That's why there is a bit of a difference in how kidney disease is treated in different systems of medicine. Allow me to show you an example of a product that is actually marketed for improving kidney function. So there's this kidney cleanse product. And if you look on the side of the box, there's a lot of there's supplement facts. So there's a lot of information or a lot of supplement information that they put onto this label. And you can see that this is a huge concoction of different types of herbs, whether there's leaves and roots and whatnot. I will point out these specific herbs here, so that there's liver ursi, stinging nettle, parsley, higher concentrations, not in food grade, but high amounts of parsley and astragalus. These have actually been, based on more modern research, have been associated with a decrease in kidney function. So these herbs could potentially damage your kidneys. So I would not recommend taking this product. Now, that's not to say not all herbal products are dangerous. Okay, there are some that are safe. We don't know if at the current moment, we don't know if any herbs actually improve kidney function or preserve kidney function, but at best, we know that kidney functions are neutral. Herbal medicines are generally neutral to patients with kidney function, but there are quite a few herbs that are dangerous for the kidneys. So these kind of products I would say to look out for, to be careful about, and make sure to ask very critical questions before purchasing these kind of products. So what kind of questions could you ask about different products? This doesn't necessarily have to mean herbals, but I mentioned herbals because I'm already on this topic, but it can apply to anything, whether it's non-prescription or prescription. So think plants. So these are a series of questions that you can perhaps put on your phone or maybe put in your wallet and write it down and put in your wallet so that you can ask. Because some of these questions people might forget to answer these questions if they're providing information to you about certain products. So one thing that a lot of people forget is that herbals are plants. Plants can technically be like vegetables, right? So they may have nutrients in them. So some herbal products actually can potentially contain lots of potassium or phosphate, which can affect your blood work. I actually remember a case that I dealt with a little while ago of a patient that had reduced kidney function with a very high potassium, and they couldn't quite, the team couldn't quite figure out why until we did a much deeper dive. So this patient was doing everything right. They were modifying their diet such that they were reducing the amount of potassium in their diet as much as they could. We switched their medications so that the medications weren't the cause of potassium. They were taking medications to reduce their potassium, but still their potassium was so high. After further investigation and after a few rounds of questions, we actually together with the patient, we actually found that they were taking a supplement called yucca, which is actually perhaps one of the richest sources of potassium. So it turns out that the supplement that we thought originally was safe, which technically, arguably you could say it was not that safe, but the patient eventually did disclose that he was taking yucca was the cause of the potassium, because once he stopped the supplement and we did a repeat blood work in the next appointment, his potassium went back to normal. So this is herbals can potentially be the cause of an increased level of potassium or phosphate. Another question to ask is to ensure that the product is licensed for sale in Canada. And using the trick that I mentioned was to look for the NPN or the DIN number on the product. Whether it's on the bottle or the label, it can be very helpful in determining if a product is safe for sale in Canada. Does the product have any water pill effects? Like I mentioned, just like with that previous product that has a diuretic or water pill effect, making the kidneys work harder, it can stress it out and cause more damage to the kidneys. Something that's obviously very important to me as a pharmacist is that does the product interact with other medications that you might be taking? So this is a very important question to ask because there are. So herbs, if you think about it, a lot of drugs were based off herbs in the past. So of course, herbs will have some pharmaceutical ingredients that can interact with other medications and even other herbs. So something to make sure you disclose to your team that you're taking if you're taking X number of herbs or X number of supplements, it's important to mention that to the team so that they can screen for interactions as well. Have there been any documented toxic effects of the herb on kidneys or other organs? So important question to ask. If there is, and it's significant enough, it's suggested not to take the herbal product, but that's one particular question to make sure you ask. And of course, the last thing is, has this product been studied in a patient with reduced kidney function? So if it has not, then it's hard to say how well this product will be tolerated in patients with reduced kidney function. So if it has not been studied, we can't really say much, and you can only assume that it will have some effect on your kidneys because majority of medications and products do affect the kidneys, or they do rely on the kidneys to process. I feel like there's someone who's going to ask me this question, so I preemptively wanted to answer this. So what about cannabis? So products such as marijuana or other products that contain cannabis, such as CBD oil. In truth, we don't really know yet. There is research being done actively. So there are people that are studying this. There's lots of people studying this because there's a lot of interest in whether or not cannabis either is safe or is effective for certain symptoms associated with reduced kidney function. Based on my professional experience, I found that people do use cannabis right? But they do it with mixed results. So the most common reasons for taking or using cannabis are usually appetite, sleep, or pain. Some people find that it works well, some people find it does nothing, and some people find it makes it worse. So it's not, so far, I haven't found any consistency. It varies patient to patient. What we do know, though, is that based on a study that was done in 2020, smoking cannabis, so smoking joints, has been associated with poor outcomes, up to and including death. So there has been associated decrease in life expectancy if you were to smoke joints or cannabis if you had reduced kidney function. It's hard to say at what cutoff, though, right? Because it kind of lumped a bunch of people together, and we don't know the difference between using joints or vapes. They lump them all together. So it's very hard to say what the association is and what the cause is so far, because we're not really sure yet, but we just know that there is definitely a strong association with a reduced life expectancy in smoking cannabis. We do know, though, that based on the same study, they also studied other forms like edibles or oils. They found that there was no such association. So it's only with smoking that they found this association. Using cannabis is not without risks, as I think a lot of people in the audience may be familiar with. So there is definitely a risk of drowsiness, grogginess, and mind-altering effects from using cannabis. So it's not without risks. There's a lot of potential unwanted side effects that can occur with using cannabis. I thought I'd kind of close off and then open it up to everyone else to ask their questions. But some pieces of information that I find are very, very helpful for patients with reduced kidney function. And I do recommend this to those that are more tech savvy or do request more information about managing their care. Here are some very valuable pieces of information. So BC Renal does have the Managing My Care database. So it contains information, patient-centered information about non-prescription and prescription medications, and I believe some herbals as well in the database. The Memorial Sloan Kettering Cancer Center Herb database contains a lot of information, and again, patient-centered language, information about different herbs. So whether or not they're safe for you and how, if they potentially could interact with medications. There is the health professional side of it too. That's pretty much just a click away. So for those that are more medically inclined or for those that are able to read medical literature, they could actually access that in the same database. So it's open to the public. It is an American source and it's not necessarily for patients with kidney disease, but it does provide quite a bit of information, background information about different herbs. The National Kidney Foundation contains rich with lots of information. So you can find a lot of it in the A to Z Health Guide. In this database, there is this page which contains information about herbal supplements and kidney disease, which is the last link at the bottom. It actually contains charts, so it names out specific herbs that can potentially harm the kidneys or can affect your blood work if you have kidney disease. So it's a very, very good source of information to determine if a product may be dangerous for kidney disease. So I thought I'd open it up for questions and to also prompt a discussion and ask the audience, what does herbal medicine mean to you? And I'm mentioning this because I understand that herbal medicine is not just an intervention. It's not just a medication or not just something you put in your mouth. Herbal medicine can have a lot of social connotations to it too. And as you know, someone who's grown up actually using herbal medicines when I was a kid, I can appreciate that there's a lot of different things to herbal medicine. So don't think of it as just as it's just as a medical intervention, but also what does it mean to you in the social context that you live in. So for me, for instance, I understand it as friends and family would recommend certain herbal medicines as an expression of care. So whether or not it's safe is another story, but it's usually meant to with good intentions, usually. So I opened up the question and the answers in the comments to the floor.
Okay, that's quite a presentation. So do we have any questions? I don't see any hands. No questions? Erwin, you have a question? Go ahead.
I do, Frankie. Thank you very much. Very, very interesting stuff. Going back to the NSAIDs that you were talking about at the beginning, Is the impact on kidney function dose dependent? Like, for example, is a regular strength going to harm your kidneys less than extra strength or arthritis strength?
That's a fantastic question. So the use of NSAIDs is not necessarily dose dependent. The extent of the damage is dose dependent, but any dose of NSAID could potentially cause harm to the kidneys. So the answer is yes and no. So the recommendation is to avoid it completely because any dose will cause damage, but the dose will determine the extent of the damage is the best way I can explain it. I hope that
Thank
makes
you.
sense. Does that answer
Yeah.
your question?
Yes, it does. Thanks.
Boy, we have a quiet crowd today.
I do have a question about a leave actually, and I'm in no danger. My EFGR is well above 60 right now, but a leave I take one. Oh gosh, I might take 6 a year. That's certainly not going to do any damage. I don't think, but sometimes I'm in real pain and I just have to take one.
So you're asking if that does have any impact on your kidney function? Okay, I see. It's truthfully to be told, I don't know your full history. So it's hard for me to really answer just because it really depends on your diagnosis and it depends on other factors of your reduced kidney function. So I can't say for sure. I can't say yes or no. I think that's best suited to mention to your team because they can certainly advise you. I guess more personalized than I could.
So I'm going to jump in here. Frankie, do you have any other suggestions other than a leave? A leave, I think
A
it
leave
was.
for Advil.
Yeah, and a lot of people think Tylenol does not do it for them. Is there anything one way or another, maybe in the middle somewhere here?
That's a good question. So yeah, I mean, we still say the go-to is Tylenol or acetaminophen as long as it's safe for you to take, because it does not necessarily affect the kidneys. But other alternatives could include topicals, so things that you can apply to the area. Okay, so generally speaking, I know BC Renal does suggest that using a short course of medications such as Voltaren Emulgel, which is a non-prescription medicine, may be suitable in context of the kidneys. So if your pain is very localized to a certain area, so a topical like a Voltaren could be helpful. Okay, but again, double check first. Okay.
Hi, Frankie. My name is Smita. I'm new to this group. Just a question that has been sort of weighing on my mind is things like ashwagandha or anything that's going to provide energy. Is that something that is also going to be harsh on the kidneys?
I can't. So it's a great question. For ashwagandha, I can't say I'm 110% sure right now. It's again very context specific, right? Some patients I'll disclose, like some patients have taken ashwagandha despite having a reduced kidney function, and it depends on, of course, the percent kidney function and the other parts of your picture, right? So yes, it has been done. Can I say it's safe? It's uncertain because we don't know. It's not been well studied in patients with kidney disease. But that's a great question. Something, if you're interested in using that product ongoing, certainly mention it to your team so that they can check for interactions. Okay.
Okay.
Tracy
Thanks.
has her hand up for a question.
Yes, I do. Thank you. Hi, Frankie. You actually, this was an excellent presentation, by the way. Thank you very much. Very informative. Replavit, you actually mentioned it in one of your slides there with the NPN. Question about that. I've actually been doing some research and that has come loud and clear to me, that particular multivitamin. I'm just wondering what your thoughts are on it specifically. And then the second part of this is Renadryl, which also has come up in my research. It's a probiotic that is available specifically for kidney disease, primarily IgA nephropathy, which is what my son and I both have. So
right. Okay, so I'll try to answer your question in parts. The first question was, what are my thoughts on using Replavite? I believe that was your question.
That's correct. Yeah.
Okay.
Yeah.
So Replavite is commonly recommended for patients that are on dialysis. It's actually what we usually prescribe for all patients that are on dialysis as a means of replacing whatever you lose in dialysis. Now, if that obviously may not be applicable, or patients that are not on dialysis but have reduced kidney function. The proportions of the vitamins and whatnot that are in there are relatively small, and that's by design. It's supposed to be specifically formulated for kidney function, reduced kidney function. So, do I believe it's safe? Well, yes, but again, your situation may vary, right? So it depends on your blood work. It depends on other parts of your diet and etc. So it's best if, again, it does require a much more thorough assessment before suggesting it to anyone. So I don't suggest it for every single person.
Okay.
If you're not on dialysis.
Okay.
So that it's very specific to your case, I would say.
Thank you.
Okay.
Yeah.
But it is common, I would say. The second part of the question was the probiotic product, which I actually have heard of before. I know some patients have asked me about it. So far, based on the information that I know, it's not 100%. It's not confirmed in clinical studies. I know that there was some association with improving an IgA nephropathy with the use of these probiotics, but they were fairly small. So
Okay.
it's hard to say if it's actually helpful, and I don't know if it causes harm. The caution I will mention, though, is that for patients that may have IgA nephropathy that are on immunosuppressants, the probiotic is active, it's alive. So
Yeah.
there is a potential of causing infection from that in that regard. We don't know that for sure yet, though. That's by speculation. But is it helpful for patients with kidney disease? We don't know yet.
Okay. All right. Very good. So also in my research, I've come across specifically again for IgA nephropathy there are 4 new medications that that are being tested right now. One's been approved by the FDA, and none of these are available in Canada yet. And I that's the frustrating part about it.
We do lag.
I'm sure we agree. Anyway, I assume that at some point there'll be like Tarpeo is the one that's approved by FDA now. And I assume that these will make its way into some testing in Canada eventually. But,
Yes. So Health Canada they do lag behind a little bit. Just I'd like to rationalize it as a cautious approach to see how it functions in the real world before they approve it into Canada. So yeah, there will be a delay. I haven't heard too much about it yet, to be really honest, in terms of whether or not it's coming into Canada. But I would anticipate that if the results are good, then they probably will eventually. Just
Great.
In a few years.
Yeah, that's good news. Thank you.
Thank you, Tracy. Oh, Erwin, you have your hand up? Oh, sorry. Sorry, Linda had her hand up first. Linda?
Thanks. You mentioned the Voltaren. What about capsaicin?
Capsacin? That's a great point. So capsacin, I will admit it's a bit spicy because it's literally made from chili peppers. So some people don't tolerate it very well. But capsacin is very commonly used for certain things like nerve pain. That can be used. It is considered safe for patients with kidney disease, provided that they apply a small amount first because it can burn. But yes.
Okay. And sorry, you also mentioned probiotics. So probiotics generally are okay?
Sometimes. So in terms of, in context, it's just kidney disease alone, it's considered neutral. But there are some kidney diseases where patients may be on immunosuppressants, right? So medicines that would suppress their immune system, in which case it may not be appropriate in those cases.
Thank you.
Talking about topicals, it's Lloyd. I use KAYLA quite a bit. KAYLA.
Oh, it's a KAYLA?
Yeah.
So did you want me to comment on that, or?
Yes, please.
Yes. Okay, sure. It's hard to say. So I believe KAYLA, if I'm thinking of the product correctly, that's the one that contains methyl salicylates. There is a very small amount of that does get absorbed. So we're kind of on record, I would say it's not recommended, but I have seen patients use it. So the methyl salicylate contains is a form of an NSAID, in other words. Granted, a very small amount of it does go in the blood. So if you're using it in a small area for a short period of time, then I don't see that as a problem. Okay, but it's hard for me to say. It's really depending on the person and depending on
And
the case.
And I think too that all topicals have that possibility of going into the bloodstream eventually.
You're right.
Yeah.
Yeah, especially if you're applying it to open wounds. So that's why it's important not to apply it to an open wound, not to apply it into any orifices, and etc. And applying it to just a small area. Okay. That's what we usually suggest. Some of them do absorb less than others. So for example, with Voltaren ML gel, that very little that actually goes into the blood, comparison to some other topicals, but some of it does actually go in.
I had another question, Frankie. It's Tracy again. Fish oil. Way
Yes.
back when my son was with a pediatric nephrologist, she highly recommended fish oil. And I understand it is quite good for the kidney. And, from that period of times, like many years ago now. I also understand there's like a prescription formula fish oil that is sort of higher concentrated. I just wanted to get your thoughts around, first of all, continuing to take fish oil, and secondly, the high potency one.
I see. So I'll answer it again in two parts. So the first part was fish oils in general, are they good for the kidneys? There have been some studies that, and I know there were some studies, I believe were actually one of the participants in one of the clinical studies on whether or not fish oils were helpful for patients with kidney disease. So far, I think I'm not sure if the results have been published yet, but I think there was some association with an improvement, but it's for very specific diagnoses. So it's not applicable to all kidney diseases. It's for very specific ones. I think IgA nephropathy was one of them, but don't quote me on that. I'm not 100% sure right now. The only warning I mentioned with fish oils, so if you're using things like omega-3, omega-6 kind of thing, that's different from taking fish oil, like cod liver oil. So cod liver oil, we do say is not necessarily safe for kidney patients because cod liver oil generally contains a very high amount of vitamin A. So omegas are usually okay, is what we say. Not for everyone though, because it's depending on the diagnosis, and it's not necessarily safe for everyone. Fish oils do have a blood thinning effect. So if patients were taking blood thinners, for instance, that could actually cause a bleed. Or may increase bruising if you were to take fish oils with certain blood thinners. As for the second part of the question, the high potency one, so there is a product that's the brand name goes under Vascepa. So it is a prescription form. It is actually a medication. It's pharmaceutical grade. It's used for specifically for patients with certain types of cholesterol issues. So if they have if they run with certain types of high cholesterols or high lipids, is what we say, or high fats and triglycerides, then that might be prescribed for those specific patients. That's not officially, at least from as far as I know, as of current, it's not officially used for patients with kidney disease If they have if they have cholesterol issues, then yes, it would be prescribed in those cases. But in just for kidney disease, I don't believe it's been approved for that.
Okay, great. Thank you.
Thank you very much,
Erwin, do
Frankie.
you still have your question?
Really appreciate your knowledge. It's excellent.
Erwin, do you still have a question?
No. Lloyd actually preempted what I was going to ask.
Okay.
This has been a
Anybody
great
else have any
conversation.
questions?
No,
No,
just to
Frankie?
say, no, just
go
to say
ahead,
that,
Lloyd.
just to say that this has been great and awesome. And I made all kinds of notes here. And
great.
when we talked about fish oil, I didn't think about it, but I'm glad somebody else did because
Yes.
I'm a heavy user of that. My optometrist has recommended it, so I don't see wavy lines in that sort of thing.
Yes.
And it's
For
working.
that too. Yeah.
Yeah. Good to know.
Thank you for your participation, everyone. I hope this was helpful.
Thank you very much, Frankie. Is there any other questions? Anybody else? Hey, thank you so much, Frankie.
All right.
Thank you very much.
Thank you for having me.
Thanks. Take care. Thank you.
Thank you.